few housekeeping notes. If you are a member of the media, we do have a few media packets available in the back. If we're out, feel free to reach out to me at the end and I can get you a copy. Additionally, we will also be answering questions at the end, so if you do have any questions, please hold them until that point. First, we're going to be hearing from Nadine Pottinga, the CEO of United Way of Northern Shenandoah Valley. Additionally, we will also be hearing from Don Graves, the CEO of United Way of Front Royal, Warren County, as well as Sue Dyer, who is a member of our Alice community. We're very lucky to have her here today to have her tell us her story. We will also be hearing from some of our sponsors, specifically Union Bank, Scott Arthur. At this point, I would like to turn it over to Nadine Pottinga to begin the conference. Thank you again.
Great. Thanks, Elise. You guys will have no problem hearing me. I know that. Never heard that before, that you wouldn't be able to hear me. Welcome, and thank you all for coming. This is such a great turnout. I know we've been so excited about releasing this report. I've had to sit on it for a while, but I'm glad this day is finally here, so thank you for all coming. I'd also like to thank Dr. Jason Van Huculum from the Winchester Public Schools Superintendent for joining us today, as a lot of these Alice families have kids within his district. And I'd also like to thank all of our partner agencies who attended and all of the board of directors from United Way that attended today. They gave me a leap of faith when they gave us the okay to go ahead and pursue this, and I'm happy they've all joined us here today. So thank you. And thank you to the media, press, who joined us today and will help us spread the word. So thank you. In February of 2016, representatives from United Ways all across Virginia came together to talk about some concerns that we were hearing in our communities. It was clear that we all had one thing in common. We were hearing about families in our communities that were struggling to make ends meet despite being employed. These families were making tough choices every day. We decided we needed something to provide us with a framework, language, and tools to measure and understand the struggles of a growing number of households in our communities that do not earn enough to afford basic needs. Rappahannock County United Way introduced us to the Alice Project. The United Way Alice Project is a collaborative project, collaborative effort to improve the lives of vulnerable, low-income Alice households. Based on the overwhelming success of this research in identifying and articulating the needs of this vulnerable population, the United Way Alice Project has grown from a pilot in Morris County, New Jersey in 2009 to the entire state of New Jersey in 2012, and now nationally with 15 states participating. The United Ways in Virginia are proud to join some 450 United Ways from these states to better understand the struggles of Alice. This report wouldn't be possible without our statewide sponsors, Union Bank and Trust and GEICO, as well as the support of 23 Virginia United Ways. At this time, I'd like to introduce Scott Arthur, local representative for Union Bank and Trust.
Thank you very much, Nadine. First, I'd like to thank Nadine and her team for all the wonderful work that they do to support our United Way and the 42 agency partners. It's very important work that you do, and we're very appreciative of what you do every day. We're here today to learn more about the Alice Report. Union Bank and Trust is pleased to be the statewide sponsor for the Alice Report to help raise awareness of this often overlooked population. The information contained in the report will help develop and expand programs in the Commonwealth that can help this hidden population achieve their potential, which will create a more vibrant community for all Virginians. We're fortunate in the Northern Shenandoah Valley to have our United Way lead this effort for our community. So at this time, I'd like to turn you back over to
The United Way Alice Project provides high-quality, research-based information to foster a better understanding of who is struggling in our communities. To produce the United Way Alice Report for Virginia, a team of researchers collaborated with a research advisory committee composed of 13 representatives from across the state who advised and contributed to the report. We'd like to thank Mary Zubal from Valley Health Systems for being the local representative for our community, and she's here today. So you're probably all wondering, so who is Alice? With the cost of living higher higher than what most people earn, Alice families, an acronym for Asset Limited, Income Constrained, Employed, have income above the federal poverty level, but not high enough to afford a basic household budget that includes housing, childcare, food, transportation, and healthcare. Alice households live in every county and independent city in Virginia, urban, suburban, and rural, and they include women and men, young and old, all races and ethnicities. So why is this report significant? Traditional measures hide the reality that 39% of households in Virginia struggle to support themselves. Because income is distributed unequally in Virginia, there is both great wealth and significant economic hardship. That inequality increased by 17% from 1979 to 2015. Now, the top 20% of Virginia's population earns 50% of all income earned in the state, where the bottom quintile earns only 3%. That's in Appendix A of the report. In 2015, Virginia's poverty rate was 11%, below the U.S. average of 14%, and the median household income was $66,262, above the U.S. median income of $55,775. Yet the state's overall economic situation is more complex. With unemployment is lower in Virginia than in many other states, workers increasingly face changing job landscapes where higher paying jobs have been replaced with lower paying jobs. None of the economic measures traditionally used to calculate the financial status of Virginia's households, such as the federal poverty level, consider the actual cost of living in each county in Virginia or the wage rate of jobs in the state. For that reason, they do not fully capture the number of households facing economic hardship across Virginia, while the Alice report does. This report is far more than just about poverty. It reveals profound changes in the structure of Virginia's communities and jobs. It documents the increase in basic cost of living, the decrease in the availability of jobs that can support household necessities, and the shortage of housing that is affordable to workers in the majority of the state's jobs. The findings are stark. The impact of the Great Recession was even greater than first realized. And despite some improvements in the economy and jobs, and in the 5 years since the technical end of the recession in 2010, the rate of households that are struggling continued to rise. In 2007, 33% of Virginia households had income below the Alice threshold. That increased to 35% in 2010 and continued to increase through 2015, where it reached 39%. In contrast, the official U.S. poverty rate in Virginia reports that in 2015, only 11%, or 342,000 households, were struggling. But the federal poverty level was developed in 1965. Its methodology has remained largely unchanged despite changes in the cost of living over time. And it is not adjusted to reflect cost of living differences across the country. So let's meet Alice. Alice households are working households. They hold jobs, they pay taxes, and provide services that are vital to the Virginia economy. In a variety of positions such as retail salespeople, laborers, customer service representatives, medical professionals, restaurant employees, and office workers, the growth of low-skilled jobs is projected to outpace that of medium and high-skilled jobs in the next decade. At the same time, the cost of basic household necessities continue to rise. Given these projections, Alice households will continue to make up a significant portion of households in this state. But to truly understand who Alice is and why we're so excited about this report, you need to be able to talk to people who are Alice. So, her name's not Alice, but that would have been a cool little tie-in. But today we have with us Sue, who is a member of our community, living within this Alice threshold, and we invited her here today to tell us a little bit about her story. So, Sue, welcome, and thank you for being so brave to come and speak with us today.
save up enough money to get one, because you may have them all, but just to get one. I do work 40 hours a week, every week. I cannot afford to miss a day. If I'm feeling bad or I'm sick, I have to carry on, I have to push on. I don't have that opportunity to call in and say, I can't make it in today. Well, I do, it's just that I can't afford to do that. Let me rephrase that. I have tried to get help. I've gone through social services numerous times, trying to get help, just a little help, not much, just to get me through. But you know, if you make that $1 over that certain amount that they have for you, their line or whatever you want to call it, you will not get help. And that's what they've told me. So I make too much money to get help, basically. I mean, it's not too much money to me because we live paycheck to paycheck. My husband does get disability. It's not much. So between that and what I get from work, I mean, it's hard, but you have to do it. At Winchester Day Preschool, that is another reason why I love working there. We have this sliding scale. We have so many families come there, it's just like me and probably a lot of other people out here, that they work every day, and they work hard, and they come in, and you know they're struggling. They're struggling just like I am. They're struggling just like all the other teachers that work there, and plenty of other people, you know, in Winchester and everywhere else. They are struggling. So we have a sliding scale that we actually can offer our families, and it makes me feel good working there, knowing that we have the opportunity to help that family. You know, ease their mind a little bit. You know, that they can have child care for their child and not have to, you know, worry about where they're going to get, you know, care and that they can afford. And that's just one thing that we do there. There's many, many other ways that we try to help our families. But that to them, or just, you know, it's a big deal. And the Alice program, I feel that you know, if we get that out there and spread it around, that maybe there will be an organization, or maybe they can come up with some kind of program to help the Alice family. To help me, you know, because I could use it. But so I think what they're doing is amazing, and I hope it gets out there and we can do something about it.
Great. Thanks. Thanks so much, Sue. Like I said, that was very brave, and we appreciate you speaking out and helping us get the word out. I'm going to share a few key findings and some of the methodology of the report. The report's 250 pages long, so forgive me if I wasn't able to summarize the whole thing in a short press conference. I could read the whole thing to you, but we would be here all day long, but I would love to because it's fascinating. The report will be available on our website. I know the question most people ask me is what findings surprised me. I think what surprised me is that nothing surprised me. You know, we've been hearing stories like Sue's from our partner agencies who are bravely serving this population, and from members of our communities. For those of you that know, United Way runs a lot of United Way campaigns and local employers. We've been hearing stories from them. So what surprised me is that it didn't surprise me, because these are the stories we've been hearing from folks all over our community. In Virginia, there are about 900,000 Alice households, 859,079 to be exact, while another 342,112 live below the poverty level, and that's about 39% of Virginia. So households, the report breaks out the Alice threshold in each county and city as well in the state, and that ranged from 22% on the low end up to 66% on the high end. In Clark County, 40% were considered Alice in poverty. Frederick County, 34%. Shenandoah County, 45%. And Winchester City, 50% of all families were considered particularly those that are single female-headed, were most at risk for being ALICE. Nearly 1/3 or 32% of senior households in Virginia qualify as ALICE. That's more than triple the 9% of senior households in poverty. In Clark County, while 40% of total households are ALICE, 55% of seniors in Clark are considered ALICE. In Frederick County, the lower of all our jurisdictions, at 34% of all households in ALICE, 49% of seniors in Frederick County are considered ALICE. Knowing that the senior population is growing, particularly in Frederick County, it goes to show that over the next several years, that number could grow. In Shenandoah County, 41% of households are ALICE, and 44% of seniors are. And then in Winchester City, probably due to the demographic, 50% are ALICE and 42% of seniors are ALICE. There are 890,000 families with children in Virginia, and 37% of them have income below the ALICE threshold. Families headed by single women with children are much more likely to struggle financially. They account for 22% of all Virginia families with children, but 48% of those households fall below the ALICE threshold. ALICE is also income constrained, part of the acronym. In Virginia, 57% of jobs pay less than $20 per hour, with 52% of those paying between $10 and $15. In 2011, 17% of Virginia households had less than $4,000 in savings or other assets. Many households in Virginia do not use basic banking services. In 2015, 29% of Virginia households with annual incomes below $50,000 had used an alternative financial product, such as non-bank money order or non-bank check cashing. What came through the report is that affordability of housing was noted as a large barrier to ALICE families. In Appendix G, there's housing data by county and independent city, which notes the gap in rental stock affordable for households below the ALICE threshold. I know that's been a big conversation in our community lately. In Clark County, there's a 291 unit deficit. In Frederick County, it was 4,213 unit deficit. In Shenandoah County, 495, and in Winchester City, 824. ALICE is really the new face and the new reality of poverty. Since the recession, it's become increasingly important that we define ALICE and we start to have this conversation. I was really struck by how the poverty rates have not really changed all that much since 2007, but the ALICE rates have. So in Clark, since 2010, poverty has gone up 2% and ALICE went up 3%. In Frederick County, poverty actually went down 1% from 2007, but ALICE went up 11%. In Shenandoah County, poverty went up 1% from 2007 to now, but ALICE went up 10%. In Winchester City, poverty rose 3% since 2007, and ALICE went up 8%. And we believe we will see that continue to rise, and that the poverty levels stay pretty much the same, but the ALICE families continue to struggle. In the report, you'll notice that the ALICE threshold is based upon the household survival budget, and that determines how many households are struggling in each county. The household survival budget contains housing, childcare, food, transportation, healthcare, miscellaneous, and taxes. And those are all listed in the report based on where they got those figures from. I will note that under healthcare, starting with the 2016 ALICE reports, the healthcare cost does incorporate changes from the Affordable Care Act. Because ALICE does not qualify for Medicaid, but in many cases cannot afford even the bronze marketplace premiums, they added the cost of the shared responsibility payments. Included in the report is also a household stability budget. This household survival budget is the bare minimum that ALICE families need to get by. There's also a household stability budget, which helps us identify how we can get Alice families to a more financially stable place. Additionally, there's an economic viability dashboard, which is composed of 3 different measures: a housing affordability index, a job opportunity index, and a community resource index. And that's available for each city and each county. So why are so many families struggling? I've talked about it a little bit already. Low-wage jobs dominate the economy, with more than 57% of all jobs in Virginia would pay less than $20 an hour. The basic cost of living is outpacing wages at this point. The economic conditions worsened for Alice households from 2007 to 2015. And while public and private assistance helps, as Sue talked about, it doesn't provide financial stability, and many Alice families are not eligible for certain assistance. So I'm going to let Don Graves from United Way for Rural Warren County come up, and then I'll kind of wrap it up about what our United Way's next steps are from the report, and then we'll take questions and answers. So please welcome Don.
Thank you all for coming today. Nadine told me she was covering the report in great detail, and I think she did that. So thank you, Nadine, for inviting us out. We could have had our own press conference, but it's just, because it's a statewide initiative and because we're all partnering, we need to show that we are a united front in this initiative. I came on board kind of midstream on the Alice projects. Just started not even a year ago with United Way for Rural Warren County. However, the Alice audience, the Alice market is not new to me. I've been working with them for years in my nonprofit career. They're everywhere, and they're the people that we know and we love. They're our siblings, they're our kids, they're our coworkers. They're the people who are providing us services when we go grab lunch. So it's something that you see these people, you talk to them all the time, and many times they will never ever tell you they're struggling. And that's something that strikes me, is that they will continue to try to provide as best they can and make do when they have to. 37% of the population of Warren County is either at Alice or in poverty. And so of the number there, 27% of that is strictly Alice. And what we're seeing is that there's that growing number, like Nadine demonstrated, was we're seeing that increase. We have an increase in retirees. We have an increase of folks that are disabled. We also have an increase in folks that don't have access to reliable transportation to get to jobs that maybe pay a little better to get that bit of a cushion built up. So my conversation with my board, with my agencies, is what do we do about it? What are those next steps? How do we address these folks? How do we start providing them with resources or something to help them get to that next level? So it is possible. We just have to figure out what works best in our communities. And we know that each community has a little different base. The jobs are different in each county. I lost my thought there, sorry. The economic condition. In Front Royal itself, we have a huge shortage of affordable housing, and that's been on the conversation table for many, many years. Myself being new to the community, that was one of the first conversations I had when somebody calls it, what are you going to do about affordable housing? I'm like, well, let me find out. Now we have data that we can take and say, hey, look, this is what's happening in our community. We need to make some changes. And if we can start leading that front, then that would be something that could have tremendous impact on our Alice families. And so it's something that we really do need to take that serious look and find out what are those key things that will help. It's not always more money. But I've also heard Alice families in desperation go, I'll just quit my job and go back on welfare service, qualified benefit. We don't want them to do that either. And so it's how do we keep them from falling back? And so that's something that we're looking at. I formed an advisory board in Warren County to start addressing some of these issues and figuring out some solutions that we can maybe put into place some programs or put into place some partnerships with agencies able to address these issues in the community. Turn this back over to you.
Thanks, Scott. So the most common approaches to overcoming these barriers are short-term efforts that help an Alice family weather an emergency. Temporary housing, child care assistance, meals, and rides to work help Alice recover from the loss of housing, a lack of food, an accident, or an illness. And these approaches can be crucial to preventing an Alice household from falling into poverty. These short-term relief efforts are not designed to move households to long-term stability. And I will say, many of our partner agencies are already working with these Alice families to help them from being one emergency away. So I'm not saying just United Way is doing this. All of our partners are already doing it, and we hope to support them in that. The issues affecting Alice are complex, and solutions are difficult. Real change requires identifying where barriers exist and understanding how they are all connected. Only then can stakeholders begin to envision bold ideas and take steps necessary to remove barriers so Alice families can thrive. We will respond by joining the effort of United Ways all around the state of Virginia to bring this issue out of the shadows and ignite a grassroots movement to give Alice a chance to thrive. We are raising awareness that Alice exists and that we need to address Alice for the economic well-being of all. When Alice is successful, we are all successful. We will advocate for wide-ranging and long-term policy solutions that get beyond the traditional partisan debates and considers how we can work together, nonprofits, government, businesses, to create solutions for our residents and for a stronger community. Additionally, we've really seen that access to the wide range of partner agencies that are serving this population can sometimes be hard to find. And so we are looking at creating a resource center, a place where Alice families, if they don't qualify for services at DSS, when you qualify for services, you have somebody that walks you through the spectrum of assistance that's available to you. When you're $1 over, you don't qualify for that, where do you go to have someone to walk you through that process? Well, we found that there really isn't a place. They call United Way, we provide referrals, and we give people phone numbers to call, but at the end of the day, we figured we could do more. We could be a place where Alice families could come, or the school district could call us, and we could connect them to the services that already exist. So Alice is changing the way we think about our community. It's informing our community impact strategies, and it's definitely validating our work and helping us articulate it. So we hope that you will join us in this effort. I hope you'll all go back to your computers and download the report, which is available on our website, unitedwaynsb.org, as well as the Alice website. And then I hope you'll call us and figure out how you can be a part of this movement. Thank you for all attending, and I'll invite Dawn back up here, and then we'll answer questions. Yes?
I have a question. You have the federal poverty level, you have the Census Bureau data which you use, but nowhere in the report does it mention the cost of living as how it applies, and yet that's the criteria that you say is, you want the Alice family to get above that cost of living. But what is that cost of living?
So the cost of living that they use in the report is the methodology that I explained about the Alice threshold. So that, I can find that, which page that is on, if you give me a second. That is how they determine the cost of living. And it's based on the housing, transportation, and their sources from each of those. And that is on page 124 of the report.
Is it a specific percentage? I mean, we always talk about the cost of living going up 1 or 2%, but is it a variable that changes every year?
Yeah, so in 2 years, there will be another Alice report that will come out that will update that data. So we will have every 2 years a comparison on the household budget, or what they consider cost of living, which is the household budget, whether that goes up or down, as well as the number of Alice families. So we'll, every 2 years, be able to have a comparison.
And one last question, is this really a call out to the business community? Because in effect, they're the ones that are paying salaries that aren't enough to make people, so is this a call out to the CEOs of the companies? I know you have about 14 national companies that are involved in the study, but are you really saying, you know, instead of the services that now help, you know, people that are economically challenged, but now you're saying it's time for the business communities to think about what they're doing to the employees that support them?
No, actually, it's completely the opposite of what we're saying. This isn't just a wage conversation, it's a broader community conversation. So we're talking about affordable housing, we're talking about transportation, we're talking about things that support Alice families. Low-wage jobs are not going to go away. They're vital to our economy and vital to our community. So it's not at all a wage conversation. It's how do we support Alice families in different ways, and as a community, how do we communicate to our representatives what Alice families need in order to be successful?
Well, and just to add on to that, employers need to be part of that conversation. Because like I said, more money is not always the case, and a business owner is going to come back and say, I'm not giving more money. But what we found is sometimes there's alternate solutions for that particular employee that may be struggling with a particular issue. The employer can be of assistance in creating a solution based on what's causing their issue. You know, what's that barrier that's holding that employee back? And that's been shown time and time again. Sometimes it's assistance with college costs. Sometimes it's shifting schedules so that transportation works out a little bit better, so that people don't lose jobs for being late because they don't have reliable transportation. So there are certainly employers need to be part of that conversation.
Yeah.
I have a question.
Yeah.
Hello everyone, my name is Kathy Baker.
Hi.
Hi. Recent graduate, master's in health education.
Awesome.
School debt, way up there.
Sure.
I am Alice.
Yeah.
Been Alice since 17. Mom of 8, got 3 left.
Right.
We put everything we had into our nonprofit starting in September. We currently donate to the Summer Food Backpack Program and to Winchester Senior Center. What I've come across in, not only through research, but through living here, it's embarrassment to ask for help. Being turned down at social services is really bad.
Right.
You know, I know seniors that are choosing medicine or food, you know, going out a lot of things.
Yeah.
I have a gentleman that comes to my house every evening for our leftovers. Fish and meat, you know. My husband's in and working. Not that I'm not trying. But I put a lot of time and effort into the produce that we grow for our seniors and for those that, you know, are worse off than us. But I was blessed with the ability to know how to cook from scratch and, you know, preserve life, all that stuff. A lot of these families don't know basic cooking skills. They're not taught anymore. So where does this come in Alice? You're not talking about just feeding people,
Right.
because pasta and potatoes feeds people, but it don't give them the nutrients.
Right.
And how can someone like myself become more involved and get more out there to the community?
Well, thank you for sharing your story, first of all, and certainly when you mentioned the embarrassment, you know, part of this Alice report is to really kind of break down some of those barriers, is to put a new face to what that means. You know, a lot of people still think poverty means you're living on the street, you're living off the system, and we really want to change that perception so that it's not as embarrassing. People feel like they can reach out for help. But in terms of what you were talking about food, I mean, that's definitely one of the things that Alice families have to decide between is, do we feed our families fresh produce or do we do the box of mac and cheese? So we are happy to be connect you with partner agencies that we're working with in the food space to be able to offer some of those cooking classes you were talking about. And hopefully through our new resource center, we'll be able to connect Alice families to those resources as well.
It's providing educational opportunities. I know there are a lot of families that would love to eat healthier, but sometimes you go for the quick and the easy. And so it's and affordable. I know for a long time I ate a lot of ramen. And so you do have to kind of make those choices. But having a skill like being able to can or to preserve the fresh produce when you do get it, then that's something that would help some of those families in need, definitely. But it is part of the conversation, is finding out about what opportunities are available for these families and how do we get them connected. And that's kind of, we're on the beginning end of starting those conversations. Some of the services are already being provided, some of the conversations have already been had. But there's always room to find something new in the resource center that they're putting together here, which I've talked to Nadine about because I've worked with them before in another state. It's amazing when you get a group of people together and they're all working towards that goal, the magic that happens when people are learning and understanding and then applying what they're learning in their daily lives, and they become a success. They buy a house, they have savings for the first time ever, they've paid off their debts and fixed their credit. It really truly is an amazing process to watch, and I've had that experience, and so I'm hoping to bring that to Warren County, and of course consulting with Nadine and helping her with different aspects of that.
Other questions?
I notice, unless I'm wrong, I don't think there's any government officials in this room.
Actually, I
Is
saw
that
John
one?
Hill come in.
Oh, hey,
He was
John.
here originally, but he's there now.
All right.
City of Winchester.
So we got one.
Yeah.
What is the actual plan for, I know United Way has done other studies and offered them to local governments, and the Greater United Way has offered them to, and there doesn't seem to be much of a partnership forming.
Sure.
So what's the plan for actually getting this information to government bodies and then having it used from a policy standpoint?
Sure, that's a great question. We hope that John will start to be the first one to be partner, and maybe we'll bring the report to fellow city council. I have been in conversation with Eden about it. She wasn't able to make it today, when she did let me know that, but she was aware of the press conference and the report that we're releasing. I think the difference between this report is really it's a statewide initiative. The lead researcher on it is partnered with Rutgers University. So I know that previous studies that we've released, I don't know if they've been as well received just because they've been done by us personally and our partner agencies, and maybe felt like they were a little biased towards the issues that we're really trying to look at. But this is really an unbiased approach to that, and so we hope with this new report that we'll be able to forge some of those partnerships and really be able to move that forward. So we will definitely offer the opportunity to meet with all of our elected officials or make a presentation in closed council about the report, and we definitely want to be a partner with our local officials and hope to be able to grow that partnership. So.
Beyond just the local, like state or even federal, is that part of this as well?
Yes, absolutely. And Rappahannock County United Way, which is the lead United Way on it, is taking sort of the state and national approach to it. But yes, all of those folks will also be informed on it, and we plan to do meetings with all of them as well. Rappahannock United Way is also having a press conference at the same time. So the state officials were invited to that one. Yeah. John?
Not a question, but
Yeah.
I do thank you for holding this press conference.
Yeah.
I think it's very important. Because of my own background in mental health, I am aware of some of the issues that you described today, especially the grave woman that got up today and spoke about her own issue. And I'm very pleased to know that you do intend to reach out to City Council as well as state and national leads, because I think it's very important that we all hear what Alice is all about.
Yeah.
And I think when I first heard of it, Alice, okay, but I think it's a very befitting name for this project. And while I haven't read the report, I will be reading the report. I'll be talking to more about this.
Absolutely.
But it's encouraging to know that you do intend to come to city council, and I'm sure that Ms. Freeman will be alerting other councilmen with regards to the presentation by you. And if I don't hear from her, I will be contacting you
Great.
about coming to council, because I think it is important.
Great, thank you. Yeah, and I think the partnership government as well is with our school systems and, Jason's here, but with all the school systems that we work with, families and children are a big part of this report and a big concern for us in terms of Alice, and we've worked a lot with Bright Futures and really have seen those stories through working with them. So partnerships with our school systems, which we already have great partnerships with them, will continue to grow as well.
Kind of a two-part question. One, somebody reads this and they want to help. How do they volunteer? And two, is there sort of I'm thinking of like Habitat for Humanities, where they will come in and you will help build your own house, but then you'll help build somebody else's house. Is there that sort of program that could come out of this?
Yeah, absolutely. To answer your first question, they can contact either Don or myself through United Way, our websites and our social media. As we begin to roll this out, we'll probably have calls for opportunities to get involved in broader conversations. So this is really just the start of that. So you can get on our email lists, follow us on social media. We both have separate pages, but depending on where you live. So that'll be a way to get involved. And then Habitat is actually represented here today. They already serve a large Alice population. I think they have a great model for the way that they provide opportunities for affordable housing. So we're already partnered with them and continue to do so, and hopefully a greater and more expanded way since our missions align so closely. Do you have anything to add on that?
My website's currently under construction.
Oh.
So if you don't see anything updated out there, it's because it's currently, it should be live like in the next week or so, with the new, brand new formatting, brand new look to it. So Facebook page is current and active. You can also reach out to me through email.
How many of the people that are in Alice are active on, have a computer and are active on it?
Yeah, I would have to look to see if that is part of the study. But we do have partner agencies that have access to computers, and obviously through media and word of mouth, we're going to get it out in traditional ways as well. Obviously our newspapers and hopefully our board of directors will talk about it, and if we can get it in front of city council and county council, more people will begin to hear about it. We're also going on the radio, so we've got a couple radio shows coming up in which we'll be able to talk about it. So we'll have the report available at our office for anyone that can't download it from online. It's 250 pages, so we're really trying to save money. So if someone does need it and doesn't have access to a computer or a printer, we'd be happy to provide them the report at our office. Yes?
So this report is about naming the problem and saying there is a problem, but as far as solutions go, that comes later in conversation with other people, officials, businesses, things like that. I'm having a hard time here. Earlier we said you talked about inequality and how employers are kind of sucking up large swaths of the wealth. But then this gentleman had a question and said that low wage jobs will always be part of the economy, which I think is true. But at the risk of oversimplifying this, whose fault is it? Like, what happened? Is it employers aren't paying people enough and they're just sucking the money away? In which case, what actually needs to happen for this to be?
Well, and if you take a look at the conversations around raising the minimum wage to $15 an hour, we've all heard the news stories about raising the minimum wage. What have businesses done in response to that? They've raised their prices, which accelerates that cost of living, or they've shut down and now the jobs go away completely. And so we've had quite a few business owners, and if you look in the markets where they have raised those minimum wage rates, the businesses are suffering. The patrons that went there forever are no longer going there because it's not affordable anymore. And now you turn around and because nobody's coming anymore, now we've lost jobs because they've had to downsize or close their doors. So it's where there's nowhere to place true blame, but there's an issue, and it's almost as individual as the person who's needing the assistance. And you have to really speak with them and find out. You'll see consistencies over stores, but it's something that business owners aren't going to just go, oh yeah, great, we'll do $15 an hour, no problem, they'll make more money. They're going to end up right back in the same boat as soon as the prices go up.
And I think it's important to note that Alice families have been around forever. I mean, this isn't all of a sudden a new revelation by any means. It's just a way to talk about it. And I think with the Great Recession, certain economic conditions have just exasperated maybe the issue. So it's not like it's brand new. Like before 2007, there weren't Alice families. It's just with economic conditions and the way that the economies have changed, you know, with technology coming in and taking some jobs, things are just changing. And so the problem has created, it's just been exacerbated, and we're putting a name to it now.
Isn't part of the issue the fact that the federal poverty level hasn't been adjusted since 1974?
That's another piece of it, yes, because everything changes.
Except the federal poverty level.
Except the federal.
And that's why you'll see a lot of agencies using 125% of poverty or 150% of poverty, or they use those metrics to try and determine how they're going to serve certain.
Because it's really not a realistic calculation anymore.
Right.
It does need to be.
So they've been adjusting it by using that 100%, 150%. So when they count.
You just blame the federal government like we do federal.
So it's not so much about needing higher wages, it's about economic conditions and the cost of living. And so, like, to pinpoint one issue, housing. It's not that everybody needs higher wages so that they can afford the available housing, it's
Right.
about what type of housing is available. Is that what you're, okay.
Yeah, and how do we make available tax credits and incentives for companies to build affordable housing? How do we provide incentives and resources to Habitat for Humanity, who is working on building affordable housing? So, yeah, it's not just a wage conversation, it's a community-wide conversation. There are solutions that we can put in place if we have that conversation and figure out how to make it work.
Did Alice take into consideration, going back to research, the 2013-2016 Valley Health Community Health Assessment?
Yeah.
Community Assessment. The top 10 concerns are almost identical in those years.
Mm-hmm.
That's quite a span for the same concerns to be there. Is Alice like addressing some of those top concerns? Did that come about from those reports, or has anything come about from those assessments at all?
Yeah, like I said, Mary Zufall from Valley Health, which was involved in that study, was also involved on the advisory committee for this study. Healthcare spending is obviously a large part of this. It's one of the largest spending categories that Alice will need to deal with, and with the changes in healthcare, it's obviously can be a drain. Obviously, if you have a healthcare emergency and you're just living paycheck to paycheck, that can really start to put you in financial ruin. So healthcare in general and some of the issues that came on the Valley Health Fund have been identified and are a part of this report. But yes, Valley Health has come up with strategies around those top needs and is working with United Way and partners in the community to try and address those needs. But again, they're large-scale, community-wide issues that do take time to be able to see some movement, and I think there's been some great support from Valley Health in terms of substance abuse and mental health, and so it takes some time to see those results, but I do know that they've developed some strategies